All right, got it.
Good morning and welcome back to the member meeting for the Sunflower Technology Club. I hope you all had a nice break. And as we're coming back, I'd like to just remind you about the board here. We have I'm the president, and Tim is our past president. Liz is the treasurer, and Linda is the secretary. And Sharon has joined us on the board, temporarily at least. So we'll welcome y'all back. Today we have a speaker, but before it begins, I want to ask, how many of you know what a voice assistant is? Such as Siri or Alexa? You know what that is? Okay. So next month, we're going to have a discussion about different kinds of voice assistants. And so I'm looking also for anyone who'd like to be on a panel to discuss your experience with Alexa or anything else, any other voice assistant. So if you could let us know if you'd like to do that. Now, as you know, we have speakers come to share information with the members. And we have a disclaimer, of course. This is not necessarily an endorsement of anyone. We just appreciate their willingness to come and share the information. But I can introduce Dave Shimke, and he's going to tell us all about it.
I'm on, okay. Hi, my name is David Shimke, as she said, and my wife Jeannie. You guys have interrupted our honeymoon. We're newlyweds.
No. No. He's teasing.
I'm teasing. Somebody was married 46 years.
Yeah.
We're only at 45 years. So we're trying to get away as soon as possible. So I'm glad to be here. To Kana's disclaimer, I'm a Medicare broker. Nobody represents all of the companies because there's way too many to do that. But I represent all the major companies: United Healthcare, Humana, Aetna, Mutual of Omaha, Blue Cross. I'm somebody out not on purpose. My purpose to be here today is not to get you to become my client, okay? You can go to plenty of seminars and they'll feed you coffee and cookies and all that, and they got one goal in mind, and that's get you to be your client. If you need help, we're happy to help you. My wife and I are both agents. She runs our office, but I'm here. If you need help, I'm doing that. I'll do that for you. But if you've got a good broker, I recommend you keep them and support them. Some of the things I'll talk about today are dramatically affecting Medicare and what's going on. And the law of unintended consequences is they're driving people like me out of the business. And I go, I've had enough dealing with the government and all the things that they make me do and all that fun stuff. I'll leave it at that. Okay. So what I'm going to do, the number one thing I get people calling me about is they're confused. I'm going to assume everybody in here is on Medicare. Are you on Medicare, Jeannie?
I am.
She is on Medicare. We're all on Medicare.
We are not.
Oh, you're not
We're okay, yeah.
eligible next year. Okay, good. I'm sorry. And just this is a plus 55, so I apologize.
No problem.
Yeah, I would have, now that I think about it, I would have thought you were about 46 or
Oh, that'd be
47.
awesome.
There you go. Okay. I put my foot in my mouth this summer. We've got a place in Missouri and we've got a community pool. And because I knew the husband was roughly 70, I assumed the wife was close to the same. Oh, no, I don't even think she was 60, was she? I don't know. Put my foot in my mouth real bad. So what we've got up here, I'm going to take a minute and walk through Medicare, because more often than not, when I'm talking to somebody, they're confused about what they do and do not have. So when you go on to Medicare, they're supposed to send you out a Medicare and You book every year. Okay? We've only got one of them at our house for whatever reason. They haven't sent one to both of us. But my wife's father got his just the other day. Medicare new for 2025. The book doesn't really change from year to year, but I'm gonna go through one page on this book. So if you'll turn to that page. This is a 130-page document, and I may be a little bit off, it may be 128
I'm
pages.
just trying to find the cursor here. Here we go.
There we go. If you guys would like, for any notes, I've got this on paper. Would anybody like to have one of these on paper? They can make some notes.
Okay, so.
Okay, and I've got some pins here. Just caution, when you take the pin, it twists to open, okay?
That's okay. It's your way, I can get the whole page. I mean, I did that page, but.
Up here at the top, it says there are two main ways to receive your Medicare. So the number one thing I do when I talk to somebody is to make sure they understand the difference between Medicare supplement and Medicare Advantage. If you don't know that, you're gonna be lost. And more often than not, when I talk to somebody who's got a Medicare Advantage plan, they call it their supplement. And they're just confused with the terminology. Well, let me explain. Yes.
No.
Oh, you just have to. So. Let me scroll this up a little bit. So it says there are two main ways to get your Medicare. On this side of the sheet here is what they call having original Medicare and the supplement.
Sorry, David.
All right, we're there. Get up a little bit further. So you get your Medicare card in the mail. Says Medicare A and B on it. And if you've got Medicare and a supplement, you use your Medicare A and B. I'm gonna simplify this. It's a little bit more detailed than this, but in general, most of you guys know Medicare pays for 80% of your healthcare costs. There's a little bit more detail into that, but for now, that's good enough. If you have a Medicare supplement or Medicare and a supplement, you'll generally get a Part D plan. We're gonna talk about that a lot more here in a minute. I'm gonna show you how, for those of you who are on Medicare, to check your plan for next year, the technology that's behind that. And then you purchase a Medicare supplement. Scroll up this a little bit. Sometimes people call them a Medigap plan. It means the exact same thing. Medicare supplement and Medigap are the exact same thing. Now, so in very simple terms, if you have Medicare and a supplement, Medicare pays 80%, the supplement pays 20%. There's a $240 annual deductible. With that, after you pay that deductible, the supplement will pay 100%. So we gotta go back up here, we'll talk about a couple numbers. Medicare Part A is no charge to you. That does not mean it's free. The government took money out of every paycheck you ever got in your life and put money into a trust fund for Medicare Part A. Medicare Part B is $174.70 this year. It will be going up for 2025. There are people who pay more for that. If you are in an extremely high income bracket, generally meaning a married couple making over $200,000 a year, they step it up, okay? To as much as, I can't remember what the top bracket is, but most people don't fall into that. So we'll leave that alone for right now. $174.70 for Medicare Part B, probably about $185 next year. Prescription drug plans are all over the place. Okay, so we're going to talk about that a little bit more in a minute, but you need to get a prescription drug plan to cover your prescription drugs. And then the supplements. There's a variety of companies that provide, there's literally hundreds of companies that provide Medicare supplements. Any of you here that are on a supplement, you probably have Plan G or F, maybe a Plan N. The plans are by law exactly alike regardless of what company you buy it from. So if you've got a Plan G, which is the most popular plan today, and you bought it from United Healthcare, which is the biggest company out there doing this, but Mutual of Omaha, Blue Cross, Aetna, and anybody else out there, there's all kinds of companies that I don't know the name of that sell them. But the plan is by law exactly alike regardless of what company you bought it from. Okay? So that's the simple version of that. If you want more detail on a Medicare supplement, when you turn 65, you can get a Medicare supplement with no questions asked. If you're past 65, that includes me. If I wanted to change the company I have my plan with, I would have to go through underwriting to change my plan. So to change from, we'll just pick on Blue Cross to Mutual of Omaha or vice versa, to United Healthcare, they're going to ask medical questions. But when you turn 65, they don't ask a single question when you do that. That makes sense? Question? Stop me. Okay. The other side of the page is what they call, scroll up a little bit, Dean. Medicare Advantage, also known as Part C. If you turn on your television today and watch The Price is Right or Jeopardy, probably most of the cable news show, whether you're watching MSNBC or Fox or CNN, you're going to see at least half of the commercials. I was watching, no, that was political last night. I was watching some baseball game, and I mean, they had 5 straight political commercials on. Depending on your flavor, they could hit you back and forth. But if you turn on, and that was a baseball game, so you wouldn't generally see Medicare on that. But if you turn on Jeopardy, Price is Right, the cable news shows, at this point of the year, you're going to see half of the commercials. And I say half, I'm being generous, it's probably 75%, are advertising Medicare. Most of those commercials are advertising Medicare Advantage. Okay? So, and when I say that, it sounds like a negative. There is not a right or a wrong between Medicare Advantage and Medicare Supplement. It's a personal choice. Okay? You prefer a cheeseburger or a fish sandwich. It's personal choice. It's not right or wrong. Okay. And the reason for that is right now, starting next Tuesday, open enrollment starts. And I stated that wrong. It's AEP, annual election period. During the annual election period, which starts next Tuesday and runs through December 7th, you can change your Part D plan if you've got a Medicare supplement, or you can change your Medicare Advantage plan. And you can quite easily discern that the insurance companies are very interested in this because they're spending a lot of time advertising. I don't know who's advertising more right now, the Medicare companies or the politicians, okay? Medicare Advantage is totally different than Medicare Supplement. And I'd have to count exactly how many companies there are, but not nearly as many as sell Medicare Supplement because they're county by county. So if you're here in Pima County, which we are, the plans are slightly different than they are in Pinal County, Maricopa County, or back home in Nebraska, wherever that might be. So every county is different, the way the plans work. And we have probably 8, 9, 10 different companies that are offering Medicare Advantage in Pima County, okay? Again, it's the major companies that you've all heard of: United Healthcare, Blue Cross, Cigna, Aetna, Humana, WellCare, WellPoint. You probably heard of most of those companies. So those companies, but the plans, unlike Medicare Supplement, which I said are exactly alike, Medicare Advantage plans are slightly different from company to company, okay? Now, they're not that different, but they're different in the same way that Safeway and Fry's are different. They got most of the same stuff. All the things are going to be fairly consistent between them, and the national brands, they're certainly the same, but they've got different private label, You know, you can decide whether or not the hamburger or steaks are better at Fry's or Safeway. That's for you to decide. The major thing in this choosing a Medicare Advantage plan is making sure that your doctors are in that. So your broker, your agent that you're working with, the number one responsibility that they have, that I have when I'm dealing with somebody, is to make sure your doctor or doctors are in that plan. Number one thing that we gotta do. And then the second thing is to work with you on your drugs. But scroll down a little bit again, Jane, please. Again, you have Medicare Part A and B. They include a Part D prescription drug plan in it. Now, these plans are typically no charge. On the supplement side over here, depending on your age, these things will range from $130 to $250. Over here, these plans are zero charge. Doesn't mean they're free, because there's always a charge. And it doesn't say that on there, but if you take a Medicare Advantage plan, you're technically removed from Medicare. Don't make that startle you, but you're technically removed from Medicare, because in that case, and I'll just pick on United Healthcare because they're the biggest. United Healthcare is totally responsible for your healthcare. Medicare is no longer paying 80%. United Healthcare is paying 100% of your healthcare costs. Well, you and United Healthcare, because you're going to have co-pays, and we'll talk about that for just a second. So what does that mean? People say, well, how can they do all that for free? Because what they do, and my number isn't exactly correct, but they give United Healthcare or Blue Cross or Humana, wherever you might have, they give them $1,000 a month to take care of you. And they hope and pray, what? You never go in the hospital, but you don't use it, that you're perfectly healthy. Okay, so they they always have lots of preventive care to help make sure you're taken care of. And that's a good thing. I mean, we all want preventive care. Most of us don't ever really want to go see the doctor. That's not a whole lot of fun for me. So that's how a Medicare Advantage plan works. Though, as we get down here a little bit further, well, you don't need to go. These plans all have what they call an out-of-pocket maximum. The maximum amount of money you can pay if you get sick. So I was talking with a family member yesterday who's had some healthcare issues. He's got a Medicare Advantage plan. You're getting real close to that out-of-pocket maximum. Pay attention so you don't pay a little bit more and have to try to go back and get it from the doctor or the hospital. But no, we've got another family member who has exceeded the out-of-pocket maximum a few times. And once they get to that number, they don't have to pay anything. Okay? So when I'm talking about out-of-pocket maximum, the way that these plans work, you go to a network doctor. Almost all of them, I'd have to look to see if I could find a plan that you can't go to your primary care physician for free. There might be one out there, but I'd have to look. So generally speaking, you're going to be able to go to your primary care physician at no charge. Specialists are going to run $15 to $30, okay? And so then you're going to have all kinds of copays. And when those copays add up to whatever their out-of-pocket maximum is, most of the popular plans, the out-of-pocket maximum is about $2,400 to $3,000. That kind of a range. You can find them with $7,500 out-of-pocket max. I don't know why anybody would choose one of those plans, but that's going to be a particular thing for somebody, like what they would do with that. So as you use the plan, if you start using specialists, get an MRI, using urgent care, ambulance services, any of those types of things, you're going to have a copay for everything that you use. And when those copays add up to $2,400 or $2,700, whatever your plan you choose, then you're done spending. Did you have a question?
Yeah, I could just go back to here. When you said the government's going to pay $1,000 a month to the provider, why are you doing that?
Why is the government doing that? Oh, that's a great question. Because over here on Medicare and supplement, the government is responsible for 80% of your bill. Because you're no longer on Medicare, you're on a Medicare Advantage plan. If you get sick and go in the hospital for a month, the government, if you will, CMS, I call it the government, but we're all in the same, under the same government. They don't have to pay anything. So they're enticed, they're sending that over to them, take responsibility for you. That's the way it goes.
And who gets that deduction from my social for that?
Oh, they're still taking your $174.
Government, or is it the advantage one?
No. The government is still taking that out because you still have the Medicare Part D. And when I say you're removed from Medicare, you're not out of the system. You're still in the system because you could always drop that every year. Yeah, but they do that. So the biggest copay that you need to be aware of is if you go into the hospital. Okay, you go into the hospital, most plans are going to vary a little bit, but we'll just call it $225 a night for 7 nights. Every plan is a little bit different, so don't hold me to that. But $275 a night, and most of them will stop charging you after 6 nights, 6 or 7 nights. I'm sorry. So the family member that we had that was in for 3 weeks. But they only charged him for 7 nights. Okay, so $1,575. He was done paying. When you're in the hospital, the any surgery you might have, any medications, any testing, all your food, all the doctor's visits are all covered for $225 a night. Okay, that makes sense. And so how, a lot of times people say, how do I get to that out-of-pocket maximum? It generally, not always, but it generally means that you have 2 stays of a week or more in the hospital will get you there. Okay, you do the simple math on that. You're looking quizzically at that. Okay, that makes sense? So. Let me think, if I had anything else to say there, any questions on that? That makes sense? It's always important to know which you have. People call their Medicare Advantage plan, they typically call it their supplement. If I have somebody call me that's out of the blue, that I don't know who they are, I ask them what they have, I cannot tell you, almost always, they don't know. And I'll say, take a picture of your card and text it to me, and I'll be able to tell you what you have. That they don't know, okay? Sometimes they don't even know what company they have it with. So, okay, we're gonna move to the Medicare and U-Book.
You mean Medicare.gov site?
Medicare.gov, thank you very much. Okay. We're gonna get into some of the technology here. And so, as I said before, right now, open an AEP annual election period is starting. And you can make changes to your drug plan or to your Medicare supplement plan. And you can find all that information. If you don't have a broker, you don't want to deal with a broker, you can find a lot of this information in here and you can run your drugs. So how many people heard during the first debate with President Trump and President Biden, Joe Biden made the comment that they put an out-of-pocket maximum of $200. Now, he misspoke there. I'm not going to pick on him for misspeaking there. He meant $2,000. And in the second debate, Vice President Harris repeated that and said it's a $2,000 out-of-pocket maximum. Absolutely correct. She didn't misspeak when she said that. So
For prescription drugs.
for prescription drugs. Thank you. So there's a massive change that has happened in prescription drugs for 2025. This is a part of the Inflation Reduction Act. And so they said no longer can somebody end up with a $20,000 prescription drug bill. And you think I'm exaggerating. I see we've got clients and we can just name them. She can say so and so, and I gotta know exactly who she's talking about. $14,000-15,000 a year in drugs. It's a big deal. So for these people, now, don't misunderstand it. In anything a politician gives you, if they give you something, they're gonna take something over here. Don't ever be misled on that. But for people who are on prescription drugs and high cost prescription drugs, this is a massive savings. But you've got to be very careful with what's going on. So I'm going to show you this site. It's called Medicare.gov. Now, they'll change this picture, but it's always somebody, some happy soul that looks like they're just about turning 65. Okay, sometimes there'll be a couple, away you go. So it's Medicare.gov, you want to be careful when you sign on and find the site, because there's some imposters out there that are insurance companies trying to misdirect you to their site, okay? But if you see Medicare.gov up there, away you go. How many of you have been on this site before? Okay, so some people have been on it. Scroll down a little bit. Drop a little bit, whichever we want to call that. And you find a place to create or log into your account. I'll be transparent with you. My wife's going to sign me into my account.
Well, I didn't want to save your password here, so I
Well, I
wasn't
told
ready.
you what it was.
I can't even remember.
What would you guess?
I don't know.
She knows all my password. So let's stop there for a minute. So if you've got an account, you're going to put in your username and password. If you don't, you sign in and make an account there.
What's your username?
I don't remember what I told you. It's unusual. If you had one guess for $1 million.
Okay.
Isn't that what you would?
Yeah, but that's going to show up there, so it's no secret there.
Password star.
That's what it is. Oh,
Okay. Introduce me as David. My first name is technically Gary. My parents in their infinite wisdom call me by my middle name. If any of you have any more children, it's an incredible hassle to be called by your middle name at this point. After 9/11, everything went to your full legal name, and so anyways, we'll leave that alone. So you get into this account here, scroll down a little bit further up, a little bit more. So it's got when I started my Medicare, September of 2022. I'll give you my birthday if you want to send me cards. I've got a Medicare supplement with United Healthcare, and I've got WellCare value script for my prescription drug. Okay, so up here they have a place where you can check your claims. You can pay your premium. We'll just talk on the premium for a second. If you're drawing Social Security, they automatically take it from you've got 174, they automatically take that from your Social Security. If you're not drawing Social Security, you can set up and bill it through there. So at our house, I'm drawing Social Security. My bride is not quite ready for Social Security, so they take the money out of our checking account every month. You can check claims, you can click that if you'd like to. I don't have anything big in here. I went to a dermatologist. She thought I had to have a mole removed. Scroll down here. I've met my $240 deductible. That's my chiropractor. But you can, I'm only showing you this, so it gives you the ability to go in and see everything you've done in a calendar year on your plan. Does that make sense? You can check that. Let's go back up. Go back up.
oh, further. Where else do you want to go?
I want to go back up.
You want to go to,
Then back a page.
oh, back up.
Oh, I'm sorry.
I don't think so, Dave. That's where you're at.
Go to basics.
Okay.
Oh, yeah, go to basics. Go ahead and get started with Medicare. Okay. Now, here's the number one thing that many of you may want to do this year. Go back up again. Health and drug plans, click on that. So with this change to prescription drug, that WellCare plan that I have has got a zero premium. Okay? But now you have to be very careful. If some of you might have that plan in here, or you might have a Humana plan, a United Healthcare plan, you're gonna wanna put your drugs into here and check to make sure they're all on the formulary. Because they've said a $2,000 out-of-pocket max, that's for drugs on the formulary. So if you have a drug that's not on the formulary, it could be $10,000 and you're gonna be paying that.
And every plan is different.
And every plan is different. So click find health and drug plans. Scroll down a little bit. Back up.
Go back. You want to go back to the main
No,
screen?
no, no.
Okay.
Just down. Scroll up a little bit.
I can't go up, but I can go down.
Okay, hit find plans now.
Mhm.
Did you hear me?
I did, that's where I was.
Okay. Scroll up.
I don't know why it's not showing, other plans to compare
Back
plans.
down, yeah. Here, find plans now, what does that mean?
Yeah.
We're gonna look for 2025, we're gonna continue. Now, when you get to this page, you wanna be careful of what you're looking for. They got Medicare Advantage, Part D, you've got Medigap plans, but we don't need to deal with that this moment. Make sure you're clicking the right one because you could inadvertently switch what you're doing. And if you are on Medicare Advantage and you click Part D and you enroll in a Part D plan, you will be automatically kicked out of your Medicare Advantage plan. And if you don't already have a supplement set that you've signed up for, that could cause you problems. You want to be very careful about what you're doing or vice versa. So click Part D.
I don't know.
So you can, they'll sort these, you're gonna be able to put your drugs in there like that. Get back up. View drugs and their costs. If you can, those are the couple drugs that I have in there, but we could add, you can add some drugs that you know if you want. You can put your drugs in here, and then it's gonna allow you to compare plans in there. That makes sense? So I have a client who is on the same plan I'm on. Zero premium, thought she was great to stay, but when we put her drugs in, she had 6 drugs, 5 were in the formulary, 1 was not. So I had to tell the lady, you're gonna need to move not to a zero premium plan, but to a plan that's $27. That doesn't set well with her because she doesn't understand it, but I said, but that drug isn't in the formulary. So if you want to have that drug paid for, you're gonna need to switch plans to one that's got a premium. Okay? This is the technology that Medicare has put out there for you to put your drugs in there and work that. And you can do that on both. We can go back here. We can go back up and switch to Medicare Advantage again.
Why?
Fine.
That's what I did. And it wants to take me here.
Find plans now again. Find plans now. Okay, and get Medicare Part C. Then you have to be careful of if you're in a Medicare Part C plan. We had a client call us the other day, she had checked her stuff, because historically, they had very little changes in her plan. She found out that she had one of these spray bottle aerosol, what was it? Inhaler. And that drug was not covered on her plan for next year. So she's gonna have to change from one company to another because of one drug. So you wanna put your drugs in here and check it. Okay?
Still on your prescription drug.
Well, then I had their review your prescriptions. Scroll down.
Right here.
Oh, view drugs in there. Oh, I kept hanging on to what I've got.
Yeah.
But you're gonna wanna do that for your plan, and it'll allow you to compare. It'll allow you to compare your drugs. You still need to be very careful that you might find a plan that's a little cheaper on your drugs and find out your doctor's not in.
How come sometimes the drug plan, you have to write the basic to get not the generic, but the.
I know what you're talking about.
Yeah,
File an exception. So if that drug is not on their formulary and you really need that drug, generic won't work, or you get a new drug during the year that's not on the formulary, they don't have to pay for it. You can file an exception mid-year and they will, you have your doctor sign off on it.
my doctors wrote the reason why and they accepted it.
Yeah.
So now
Yeah.
I'm getting back
Yeah.
to that.
But it's best at the very beginning to get on a plan where that drug is gonna be
The
covered.
name brand.
Well, the name brand, I guess, and it's new too, so.
Yeah.
That's very, and then that never happens for generic drugs. It's only for tier 3, tier 4
Right.
expensive drugs. But that's the way the system has worked. If your drug is not on their formulary or it's not a preferred drug, they can deny the use of that drug. So you'll have to get them to sign up on this doctor.
No, she did.
Yeah.
She did, she got it approved, so.
Yeah. And I think we're gonna see a lot more of it with this, because all of a sudden I'm seeing people with their drugs not on their formulary. Okay, and you better be paying attention to what's happening. That makes sense?
Yeah, I mean, it went up a little bit, but.
Well, a little bit isn't the issue. If it went,
Right.
yeah, the copay went from $10 to $12, just ignore that, because it's not gonna be any cheaper with somebody else in all likelihood.
And then generics went down.
Yeah.
So.
Yeah.
Careful one, careful the other.
Yeah.
Every plan is different in how they're gonna react to your drugs. And so what we have another system that we use, but we use this also. And what they do is it'll tell us in order, and this will too, in order, what's the least expensive drug plan for you. You need to be very careful if you've got Medicare Advantage about this though, because I'll just share with you, we probably spend 40 hours every summer, July, August, recertifying with the CMS Center for Medicare and Medicaid Services to be able to present plans, be a broker. When they're talking about Medicare Advantage, and they drill it into us really hard, the number one thing that we're responsible for is making sure that your doctors are in your plan. And if they're not, then I gotta tell you that. Okay, and if you choose to take a plan without your doctors being it, that's your problem, if you will. But I need to make sure. And the second thing is to make sure that your drugs are in the plan, or that you've got a reasonable alternative on those drugs. Doctors' drugs, that simple. That makes sense? And so a lot of times people, the TV ads are talking about all the dental and all the wonderful things they're gonna do for you. They're gonna come over every day and make you breakfast, give you a foot rub, and offer to do your laundry, okay? They're not gonna do it, I promise you. Now, I don't mean be real harsh on them. A lot of those are really great benefits, but they're gonna try to steer you away with some side benefit when the real thing that you should be concerned about is doctors and drugs. Doctors and drugs. Those things are taken care of with a reasonable maximum out of pocket. Then you can go looking for who's got the best dental plan and those sorts of things. But those plans change. They take those, they get it, and they take it away. If you have a Medicare supplement plan, those plans by law can never change on you except for one thing. Right. They said that price is exactly correct. We got back from a trip this summer and I had in my mail my price increase. I promise you. People ask me, is this ever gonna go up? I promise you it will go up, and I promise you in 10 years, it will be a lot more money than it is today. Okay? Absolute guarantee. Medicare Advantage, they can change those plans. They can, your doctor can drop out of it. They can take away that dental benefit. They can take away that food benefit. I mean, there's plans out there that are offering to pay your electrical bill. I should. This is being put out on YouTube. I don't want to say anything I'm not supposed to say. Does that make sense? Yeah.
What is the main reason doctors go plans?
Oh, because
Robbie, sure.
this is in and out of Medicare. There is a natural animosity between the doctors and the insurance companies.
Is there contracts, money, what's the? Or is that it?
Did you watch All the President's Men 40 years ago? It's always follow the money. It's always the money.
So there's a contract.
There's a contract and the doctors are never happy with how much money they're getting. And the insurance companies, I'm sure, will say that they're paying too much money. You know, and that's just the natural push and pull between them. So they'll decide. I mean, there's got to be other reasons why they drop it. That's generally it. And so it's not a big deal, but there are times when all of a sudden somebody will call me and say, my doctor doesn't take the plan anymore. So,
They'll get back in.
yeah. Now, let me tell you, I said a couple times, open enrollment. Even I say this wrong. During October 15th through December 7th is AEP, annual election period. You can go to your broker and you can change your drug or your Medicare Advantage plan every day. You can one day decide I want Humana, and the next day you want United Healthcare, and the next day you want Blue Cross. You get the idea. The last plan you sign up for is the plan you'll have on January 1st. Okay, end of story. Technically, there is an open enrollment period, and even I call AEP open enrollment, it's just kind of slang, okay? But open enrollment is January 1st through March 31st. You can make one change. So if for whatever reason you've got a plan, we'll pick on Humana right now, okay? I'm not picking on them, I'm just saying. You have a Humana plan and your doctor sends you a letter and says, I'm no longer contracted with Humana, you better find a different plan. Okay, you can then you find out that you can do Blue Cross with them. We can switch you from Humana to Blue Cross during that period. You get one change. You can call me a week later and say, I changed my mind. Tough luck. You can change your Medicare Advantage plan during that time. You can also technically change from Medicare Advantage to a prescription drug plan during that time. You get one change. If you call me and say, I want to do this, we're going to make sure you're already approved for your Medicare supplement plan before we take that step. Because I don't want to have you caught without the health care insurance on that side of it. Okay, but you can make another change there, but it's a little bit more precise. And if you don't like the change you made, you're stuck with it till the end of the year. They need to be aware of that. So you actually end up with almost a 6-month period that you can change plans during the year. Anything else I could have said, Dean?
The Advantage plans are an HMO style plan.
Oh, I didn't say that. Advantage plans, I generally put that up on there, that they're HMO or PPO.
Network driven.
For the most part, if you take a Medicare Advantage plan, most people, not all people, but the overwhelming majority take an HMO. And that generally means that you must see plans within that company's network in Pima County. Okay? If you're traveling, your grandkids live in Dallas or Chicago or there, you're covered for an emergency, but you can't purposely go to Dallas to see a doctor there. You're gonna be covered for an emergency, and I've had many people call me that had an emergency outside of the network and they were covered, okay? That makes sense? The PPO plans are different in that you can use their nationwide network. So if you've got, somebody says, hey, there's a great orthopedic surgeon in, pick on Chicago. You're gonna go to Chicago, that doctor's in the network for United Healthcare or Aetna or Humana. You can go see that doctor in that. I make sure all of that working. The way those plans work real well is not for the person who's doing casual traveling. It's really for somebody who has two homes. They're winter visitors here. You know that in this community, you got a lot of winter visitors. They got a place here, they got a place in Minnesota. And then we make sure that their doctors are in network in both places. That makes sense? But, and see, people would ask, well, why wouldn't everybody take the PPO? Well, somebody should have asked me that question. The reason is, and I'll pick on United Healthcare. United Healthcare's HMO out-of-pocket maximum is $2,400. Their PPO is $4,900. Okay, so you've got a lot more exposure. You can have a lot more out-of-pocket with the PPO plan. Now, if you're gonna use it and you're gonna spend half your year on the lake in Wisconsin, then that works real well for you. But if you're only taking a couple drive trips and you go to see the grandkids at Thanksgiving and Christmas, you probably don't need a PPO plan. Yes.
What's, when it says HMO-POS, what does that mean?
Point of service, most of the time, again, because there's all kinds of different companies that can mean a little bit different. But for instance, United Healthcare calls their plan an HMO POS, and the POS is about dental. So they got a big dental network, and that's about the dental network. Okay. Yes.
Within the Advantage plan, isn't there a premium for the PPO as opposed to the HMO?
On some there are, but more often than not.
You're in Pima County now.
Yeah, no, but there are. I can tell what.
Getting more with PPO, so I can see it.
No, it's just you have, so let me go through it. You have higher copays.
For PPO.
Yeah, on the PPO, you'll have higher copays. If you're seeing a specialist for in the hospital, and most importantly, you'll have a bigger, what they call maximum out-of-pocket expense. Remember I said 2,400 versus 4,900 with United Healthcare. I'd have to look at what it is with Aetna and Humana, but that they're gonna run consistent with that, roughly double the out-of-pocket max. So that's what you're gonna pay for. If you end up using it, you get giving yourself a lot more exposure to expense.
But no, MD Anderson, no.
Okay. The other thing with the HMO, the Medicare Advantage plans, I didn't say this, so let's go back. Medicare supplement, you can go to any doctor anywhere in the United States. So if you are traveling or you purposely want to go to the Mayo Clinic, MD Anderson, Johns Hopkins, Cleveland Clinic, you can go do that. If your kids live in Dallas or Chicago or Seattle, you can use that plan anywhere you want. If you have an HMO or a PPO of Medicare Advantage, they will, Mayo Clinic, for instance, the big one here, will not take Medicare Advantage plans. So you need to be aware of that. It's really important when you first sign up. Because if you're ill and then you want to go to the Mayo Clinic, so now you're going to switch to a Medicare supplement, they're generally going to turn you down at that point. So I have a couple things I'll give you if you haven't already gotten them. Boy, people have gobbled up the pens. I've got more pens here.
I can give this back if you want it.
No, I brought it to give it to you. Okay. So I've got pens. If you didn't get one, they twist to get the inker out. They work as a stylus on your iPhone or iPad, okay? Second thing I'll give you. I have a card here. Top of it, it's got a place for your name, phone number, emergency contact, and their numbers, okay? In the middle is my business card. It's got my name, phone number, email address, all that kind of stuff. And the last panel there just talks about all the things that I do. I used to do a lot more variants of things, but right now all I do is Medicare. The back, I shouldn't say all I do, but 99.9% of what I do is Medicare. The back of it is a place for your prescription drugs, any medical conditions. You put your Medicare card, your insurance card in there, and everything's in one convenient place. Now, I will share this with you. Couple things. Well, I have in an album on my phone where you got your pictures, your picture album. I have a picture of my Medicare card, my supplement card, and my prescription drug card. Okay, I have this in my car, but I travel light. So that's, you know, I carry that way. That way she can always get to what I have, don't have when I need it. Okay, that makes sense? I'll show you something else. How many of you guys have iPhones?
I do.
Get my phone here. And Android has got the same thing. You like it, but on the iPhone, if you press the buttons on both sides here, it'll go to you can turn your phone off. Okay, everybody's got an iPhone that's turned off their phone. But the top up here says slide to power off. But then they've got two different ones. One is medical ID. You go into your settings. I've got all my stuff in. So if for some reason I'm laying on the side of the road, somebody finds me, they can do this and find out who I am. They can call my wife, my daughter, and in order of who's likely to answer the phone. I actually think my daughter's more likely to answer the phone than my wife. And my son is last because he never answers the phone. But here's my contacts, some basic information. They know who I am. They also have one up here. But you know, you've seen where they've had these terrorists and they can't get into their phone. If they go into their phone, oh, they also have an emergency call. So if they don't happen to have a phone, who doesn't have a phone these days? But they can make an SOS call off the thing. Okay. Well, okay, but most people today, they don't go anywhere. They don't go into their backyard without their phone. But if somebody found you, phone, got your phone, they could make an emergency call, get your medical ID, find out who you are. That's as far as it goes. So when we've had these terrorists where they try to get in their phone and see who they're talking to, they're not getting any further. I promise you I'm not a terrorist, okay? That makes sense? But I go into my calendar, or my photos here, and then I've got an album here, and it's got my Medicare card, my insurance cards there. Nice convenient one. Okay. So if you'd like one of these, and if you didn't get a pen, help yourself, I'd be happy to have a pen. So like I said before, if you've got an agent, you've got a broker, please support them. I didn't come in here to try to see how many policies I could write today. If you need help, I'm happy to help you. Okay. That's my service in this point in my life, is to help people that need help. Okay. I think I'm done, unless somebody's got another question. Yes, sir.
Probably nobody else here is going to care about this. Never going to do anything about VA.
No.
That's area. Not to, you know, I have a 70% disability as a VA, so I don't pay any more tax. But so a VA on every block. So I have, you know, Medicare too. So I'm paying for Medicare that I don't use.
So I'm going to give you the comment that I'll have for you. I'll do two things. I have known people who have VA who did not have Medicare Part B. Okay? One individual who's no longer with us, but I mean, he couldn't afford it. The thing you have to be careful with the VA is, as you probably well aware, there's about 7 different levels of care. If someone just worked in the office at Fort Bragg and never left the States, they're getting the lowest level of care. Somebody who went to Vietnam or Afghanistan, whatever, lost a limb, they're getting the highest level of care. I don't think anybody's gonna argue, and there's all in between. So if you're getting a pretty high level of care there, you don't necessarily have to have Medicare Part B. The biggest complaint I get from people is they say, I call up, they give me, I want a physical, they set the appointment for 9 months from now, and 6 months from now, they call me and cancel. Okay, oh, no, they don't cancel, I'm sorry, I said that wrong. They reschedule for another 3 months. So you're waiting forever to get care. I have people who say they get wonderful care. The other thing you can do with VA, and so what I didn't address because I didn't even think about it, all of the companies have, I shouldn't say all, but the 2 or 3 major companies have what they'll call the Patriot or Eagle plan. And they're really carved out just for VA people. And the way that they work, so that $174, Medicare will give them back, and I'm just giving you a rough number because each of them are a little bit different, $50 back. Now, in turn, those plans don't include the Part D, the prescription drug, but you can get your prescription drugs at the VA. Okay, so you can get it for less money, and they're generally PPO plans, and they're 0 premium, give you back, if you will, $50 on it. And so instead of it being 174, it's 124. So that's something that these companies do in taking with that. But anytime you've got 2 government agencies squabbling, good luck. Okay.
Well, the reason I've kept it is because until a year ago, I didn't have any disability with the VA.
Yeah.
And I was told that if I dropped my Social Security,
You ready?
VA kicked me out because they can do that. And I get this big, huge thing to get back in.
You know, when you're dealing with the VA and Medicare, it gets delicate, and I don't like to make any over.
I don't understand why they can't make the VA just another company like any other doctor.
And let me just tell you, I'll make my last statement to you. I'm running for president. You vote me and I'll take care of all your problems. And if you believe that.
Nelson, I hear about that. Thank you so much.
You're most welcome.
Thank you.
See something after we turn off YouTube.
What else do you want?
Morning, I have a question.
Are you ending the meeting, Connor, or?
Oh, Claude, are you gonna say anything else? No.
You want me to look at that, right?
Oh, yeah, no, it's, when you were saying that PPOs were more expensive, I'm like, I don't know. Yeah, I understand.